lymph nodes in the mediastinum. That's that mediastinitis that we talk about. So when we see the chest x-ray, we're going to see this widened mediastinum. That's what we're looking for. Inhalational anthrax, 1 to 6 days incubation period, meaning you're asymptomatic after your exposure. Okay. Then you develop the famous flu-like syndrome, fever, chills, aches and pains, cough. Okay. Then, for a day or two, you might feel better. And then you're going to have sudden onset of respiratory distress, respiratory failure, and people die within 24 to 48 hours. Okay? No other specific findings, just that. 50% of these patients will develop a hemorrhagic meningitis. I'll show you a picture of that here in just a second. This is GI anthrax. Okay? The picture on the left is the gross specimen of the bowel. The picture on the right is the same patient under a UV light. And you see all those black spots? That's all dead necrotic bowel from the anthrax infection, okay, from the toxin. You may or may not remember this incident, but anthrax has been weaponized by a number of countries. Notably, the Soviets have produced tons of weaponized anthrax. In 1979, at one of their factories, one of the alarms went off as they were making this stuff. A filter in their unit was clogged. So they decided they'll replace the filter. They yanked the filter out. Okay. Right as they yanked the filter out, their bell rang for shift change. So the guys that yanked the filter out left. The guys that came on duty did not realize the filter was gone. And for a number of hours, they were spewing anthrax out into the atmosphere. Okay. Well, as you might guess, if you lived downwind from there, you were in trouble. It took them about 20 years to admit it, but they finally admitted that the incident happened, and they admit to 66 deaths. In all likelihood, the number is significantly higher than that. So, bad disease. Okay. These are two of the victims from that incident. The left-hand photograph, what you're looking at is a patient's trachea and the two bronchi coming off. And if you notice, the lung just below the trachea is totally black. Okay, that's a dead necrotic lung. Okay. The right-hand picture, that is that hemorrhagic meningitis that these patients develop. You're actually looking at the skull cap, okay, the brain, the meninges overlying the brain, and you can see all of that blood underneath the meninges. Okay, so this is what you're faced with anthrax exposure. Okay, now the good news about anthrax is that inhalational anthrax, there has never been a case of person-to-person transmission. Okay, so even though they have the disease in their lungs, they don't spread it. Okay, you can spread cutaneous anthrax. If someone has cutaneous anthrax, you contact them, you have an open wound in your hand, in your skin, okay, you potentially could get an anthrax spore in that wound and develop cutaneous anthrax. Okay. Standard precautions for all of these patients is enough to deal with them. Okay. For patients that have the meningitis, it's multiple antibiotics, a 3 antibiotic regimen, okay, along with the Abthrax, which is a antibody against protective factor. And we also have an immune globulin. If you have anthrax but you don't have the meningitis, it's a 2 antibiotic regimen, okay? And again, you don't have to remember this because over time these recommendations will change, so we won't belabor that. If you were exposed to anthrax, let's say you responded to a scene where somebody had a device that was spewing anthrax out, or you went to the post office, okay, on a report of a powder, and you got exposed to the powder. We're going to prophylax you either with ciprofloxacin or doxycycline. We'll give you the vaccine, okay? And you can see treatment with these antibiotics is a dose every 12 hours for 2 months. This is a real problem because patients are not very good about taking medications for 2 months, particularly antibiotics, okay? We do have a vaccination. Typically, the people that get this vaccination on a routine basis are those who work with animals, okay, or are high risk. For the general population, we don't immunize against anthrax. Kids can be treated in similar fashion with antibiotics as well, okay? And if we look at the post office attack from 2001 here in the US, okay, if you look at the symptoms, fever, chills, sweats, fatigue, malaise, there it is, okay? Flu-like syndrome, okay? That's what they look like, okay? One of the big differences between anthrax and the flu is the last thing on this list. The flu typically gives you a runny nose. Anthrax does not, okay? So that sometimes can help. If we look at physical findings, you know, fever, tachycardia, most of the patients had that. If we look at laboratory results, there's nothing specific that helps us. If we look at x-ray findings, most of them had mediastinal widening. Many of them had signs of pneumonia as well. Same thing with the CAT scan, okay? And if we look at the overall numbers, inhalational anthrax, there were 11 victims, 5 died, 6 recovered. That's a 45% case fatality rate. That's one of the best case fatality rates ever reported. We typically said anthrax, inhalational anthrax, has like an 80 to 90% fatality rate. Our antibiotics, our ICU care, this is pretty good, okay? There were 11 patients who got cutaneous anthrax. All of them survived, okay? So our antibiotics are actually pretty good. Questions about anthrax? Oh, one thing about the spores of anthrax. To give you an idea of how long anthrax can live as a spore, there was a museum in Denmark that in its basement storage area found a World War I artillery shell. And they realized it was the kind of artillery shell that could either carry chemical or a biologic. So they cut it open to figure out what was in it. Okay. Turned out there was anthrax spores in it. Okay. This was 1990 something. World War I ended in 1918. So 80 years. Okay. After 80 years, they were able to germinate live anthrax from those spores. Okay. That's how hardy these things are. So this disease, not one we're going to be able to get rid of very easily. Okay. Plague disease, we see a number of cases every year. Okay. Plague lives, it's endemic in rodents, particularly those cute little prairie dogs. Okay. It's the excuse we have to go kill them. Okay. Fleas live on the infected prairie dogs. They feed on the prairie dogs, and then the fleas spread the disease to us. Okay. When you get bitten by an infected flea, okay, it essentially injects you with the plague bacteria. That plague bacteria, once again, is attacked by our immune system, white blood cells, macrophages. They gobble up the plague bacteria. They transport that plague bacteria to the regional lymph node, and the lymph node then gets infected with plague. The lymph node gets swollen, painful. Okay? That's called regional adenitis. The bacteria, if it gets into the blood system, can cause sepsis, get to other organs, get to the lungs. That's when it becomes a real problem. Okay? Here's what it looks like. You got the infected rodent at the bottom left, bitten by the flea bites us. Okay? We get plague, bubonic plague or septicemic plague. If it then goes to our lungs, we can spread it from person to person. Okay? Plague occurs every year in this country. We average 10 to 12 cases of plague every year in this country. The red dots, you can see where plague is naturally occurring. Okay? Colorado, New Mexico, Arizona, most commonly. Okay? We had a case here in Colorado about 2 years ago. Guy's dog went out to go play with prairie dogs, got bitten by a flea, came back. The guy got plague from the dog. Okay, and if I remember correctly, he ended up dying from it because I think there was a delay in diagnosis. Nobody figured it out. Now, if we get a case of plague in Colorado or New Mexico, frankly, we're not going to think much about it. If you got a case of plague in Virginia, however, that's not expected because plague does not occur east of the Mississippi. Okay, that might be an intentional release. 3 forms of the disease. The pneumonic form, okay, which would be the most likely form for a terrorist. Okay, you can see the mortality, 60% if it's treated, 90% if treatment's delayed. The bubonic form of the disease, I'll talk more about that in a second, and then the septic form of the disease. Okay, bubonic plague. If you get bitten by the flea, the bacteria travels to your lymph node. The lymph node swells. That's called a bubo. Okay, that swollen lymph node. That's bubonic plague. The good news about bubonic plague is it does not spread person to person. Okay, the only form that spreads person to person is the pneumonic form when it's in your lungs. Okay, so what does it look like? 2 to 3 day incubation period. You're asymptomatic. Then the flu. Then bloody cough, acute respiratory failure, circulatory collapse, and death. Okay? There's bubonic plague. There you see a swollen, largely swollen lymph node in the armpit of this victim. Okay? Several other diseases can look like it.